Well, in this episode of McBlog, I want to take you through the submission made by the Human Rights Commission to the Ministry of Health team considering puberty blockers. You know, the medication that trans activist doctors and their allies give to confuse children because they think they want to and believe they can change their sex. So the doctors facilitate the interruption and disruption of the natural process. It's quite an eye-opener reading this submission from the Human Rights Commission, but it also displays how deeply rotten the Commission is and why it should immediately be closed, despite some positive recent appointments. Let's check it out. Now, ironically, the submission on puberty blockers is made not by the Human Rights Commissioner, not even the Race Relations Commissioner, but by the Disability Rights Commissioner. Disability? I mean, isn't that an awkward admission even before we start on this? Are we saying that kids who want to trans are disabled? I don't think that's what they're getting at. But just before we look at what this activist organisation has submitted, I want to remind you what real doctors, real medical professionals have found out and why more and more countries around the world are pressing pause and even cancel on puberty blockers. So last year, the Ministry of Health published its review of puberty blockers. Now, activists try to argue that this chemicalisation of children gives them time to think about whether they want to change their sex and potentially chop off healthy body parts in an attempt to be the opposite sex, which of course is a biological impossibility. But here's the key thing to understand. Puberty blockers don't pause, they predict. The overwhelming number of children on puberty blockers will go on to wrong sex hormones. For boys, they'll slow the growth of facial and body hair, prevent voice deepening, and limit the growth of the penis, scrotum, and testicles. For girls, this treatment limits or stops breast development and stops menstruation. Sounds problematic, doesn't it? Whenever you interfere with the natural process, and especially puberty, there's always going to be issues. Now, New Zealand has been prescribing puberty blockers and at a rate 10 times higher per head of population than the UK, where puberty blockers have just been stopped because of what's known as the 4-year-long CAS review, which concluded that puberty blockers should no longer be prescribed to children except in the context of research due to these powerful drugs' effects on brain development and bone health. It also said cross-sex hormones, estrogen and testosterone, should be prescribed to trans-identifying 16 and 17-year-olds only with an extremely cautious approach. And there should be a clear clinical rationale for not waiting until the teen is 18. Now, the CAS report also destroyed the suicide trope. You know, the better a live son than a dead daughter. You need to do what your child is demanding to change their sex. And of course, that statement is used to manipulate parents. But the CAS review said young people facing gender-related stress had no significantly different levels of suicide risk to other young people with similar levels of complex presentations. No evidence that gender-affirming treatment reduces suicide risk. Now, here's the problem. Te Whatu Ora, Health New Zealand, contracted a group to write up the guidelines for New Zealand. And they contracted none other than PATHA to write the original guidelines. PATHA stands for Professional Association of Transgender Health Aotearoa. And it's actually a group of trans activists. They supported so-called conversion therapy bans, but they want to practice conversion therapy on kids, trying to persuade them to change their sex. Ironic, isn't it? Virtually all their leadership team and advisory board are transgender and are closely affiliated with the now totally discredited WPATH, the world body. As I mentioned last week, last year's Finnish study found that the suicide risk in a large group of adolescents was predicted by the psychiatric problems that often accompany gender distress, not by the gender distress itself. Now, Chloe Cole, who detransitioned, she's from the United States, detransitioned at 16 years old and spoke at our conference last year, also didn't think about the consequences. She said it was the last thing she thought about. Here's a little clip from the interview we did with her.
Parents ever told they had to go along with what you were saying because better to have a live son than a dead daughter?
Oh yeah, that's the exact ultimatum they gave them. I mean, they initially pushed back on it. Like they tried to adjust me changing my name, and they're okay with me changing the way I dress, but they didn't want me to be making any permanent decisions until I was legally an adult, which in the US is 18, but could have been much, much later. They were guilt tripped into it by my doctors pretty much. They were told, like, well, they weren't given any other option. They weren't told about the high desistance rates in children with gender dysphoria. None of us really were given the full picture of things, even in our consent forms, a list of all the potential side effects from the treatments.
Well, even when you had your mastectomy, were you told the true consequences of that?
I was told that I wouldn't be able to breastfeed, but I was 15. A 15-year-old is not thinking about that. And on top of that, I was in the mindset of, like, I'm a guy, I'm trying to become a male, and men don't breastfeed.
Yeah, but the media don't want to know about Chloe. We brought her to the country. Mainstream media ignored her. And the Human Rights Commission aren't too interested in Chloe's human rights either. They're on a mission, as we will soon see. By the way, the Food and Drug Administration, FDA, in the US issued a warning label about the risk of puberty blockers back in 2022. So, what did this Ministry of Health review find? Well, the evidence review found a lack of good quality evidence for the effectiveness or safety of puberty blocking treatment in young people with gender dysphoria. They said, we do not have good evidence to say that the medicines used improved the longer term outcomes for young people with gender related health needs, nor that the potential longer term risks are low. Wow, that is damning. I mean, that should be the end of it. When would you prescribe something that lacks good quality evidence and has no evidence that improves outcomes or how bad the risks are? Well, yes, you wouldn't. But then the Ministry of Health, which is now between a rock and a hard place because deep down they probably want to keep pushing puberty blockers, they said, well, we're considering whether further measures need to be put in place to ensure no children or young people are unduly exposed to unknown risks, and the ministry wishes to take into account all information and views before any decisions on further safety measures are made. In particular, they say the ministry seeks input from organisations that represent people who may be affected by safety measures or that may be involved in how safety measures are used in practice. Well, does that include Chloe Cole and other detransitioners? Does that include parents whose families have been completely upended by this destructive ideology? Now, before we look at the Human Rights Commission submission, I just want to share a couple of paragraphs from Professor John Whitehall, who's the Foundation Chair of Paediatrics and Child Health in Australia, who also did a submission to our Ministry of Health. And this is a medical expert, a real doctor, not UN or human rights quango research or WPATH radical activists or the views of Chanel Lal. This is actual medical discussion. And he says this: given the recent onset of the epidemic of being born in the wrong body, the lack of studies confirming positive results of puberty blockers, and the widespread literature on neuronal side effects of blockers and administration of cross-sex hormones, and the sustained refusal of proponents to acknowledge that transgendering almost inevitably leads to chemical, if not surgical, castration and loss of sexual function, I am forced to conclude that transgendering of children is unregulated experimentation, the likes of which were condemned in the Nuremberg trials. That member of the medical professional promote the activity and are supported by factions within leading medical organisations should not justify the continued experimentation. It should be recalled the practice of prefrontal lobotomy for psychiatric disease was once prolific, was supported by leading medical organisations, and its founder was awarded a Nobel Prize. Therefore, in the interests of confused children, I submit my brief review of international literature for your consideration. I think gender-confused children should receive traditional psychotherapy with specific application of psychiatric care and support for the often associated social dysfunction. They are suffering children, often to usually burdened by comorbid mental disorder and social disruption, and should be supported through their unhappiness with compassionate care that does not challenge neuronal health and ablate reproduction. And he concludes, disregarding the potential long-term risks associated with the unrestricted use of powerful puberty blockers and cross-sex hormones, alongside the significant overdiagnosis of children as gender dysphoric, approaches a form of child abuse. Therefore, as the administration of puberty blockers to children is fraught with risks and uncertainties, with profound implications for their physical, physical, neurological, psychological, and sexual health, but with no evidence that confirms beneficence, this submission calls for the suspension of the use of puberty blockers as a treatment for gender dysphoria, gender-related distress in children and adolescents. A more cautious, evidence-based and ethically sound approach that safeguards the well-being of vulnerable children would be the more appropriate pathway. So, let's have a quick read of the Human Rights Commission submission. And they mention this. They start with, the Commission urges all actors to ensure that they are working to promote children's best interests and to limit harm to children in decision-making about processes and about substance. Well, best interests, limit harm. Exactly. Telling children they can change their sex is not in their best interests and it will do them harm. We suggest the Ministry undertake further targeted safe consultation with transgender people, including transgender children. Nope, this is a medical issue. If we're discussing treatment for any illness, is the emphasis on the patient or on the medical professional who are looking for a cure? We already know that transgender children will be struggling with mental health issues. Even activists admit that. They then say medical decisions should be primarily grounded in scientific and medical research. Exactly. But it just completely contradicts what they've just said. They then say, we recognise the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. Once again, correct. But then they reveal just how captured they are by the ideology and make this dumb statement. It is crucial that access to gender-affirming healthcare is maintained and not weakened. Chemicalise, castrate, confuse, keep it going, they say. It's a shocking statement. They then try to bring in the discrimination argument that we must give gender-confused children whatever they want because if we don't, we're discriminating against them. Interestingly, we don't say that when kids are demanding drugs or alcohol or wanting to operate a vehicle or many other age-restricted things which are designed to protect them. But the Human Rights Commission says, sex is a prohibited ground of discrimination under the Human Rights Act. It has long been interpreted by the government and the Commission as inclusive of gender identity, which includes transgender and non-binary people. Well, nope, it's been interpreted that way, but that doesn't mean it's correct. It's been interpreted and pushed by activists, compliant media, and weak politicians. But the reason they push this is so that they can say you can't discriminate against gender-confused kids. You're not allowed to act in their best interests because it might hurt their feelings. They then say the inquiry into the impact of puberty blockers has been restricted to impact on gender dysphoric adolescents. It is not clear in the consultation documents why the impact assessment has been restricted to this group. Well, they're trying to link this whole issue with the correct use of puberty blockers for precocious puberty, the early onset of puberty. But that doesn't involve attempts to change the sex of a child. I mean, this is just mischief making. But then they come back to the discrimination, the HRC's only real argument. If a restriction on access to puberty blockers was implemented, then discrimination could also arise as compared to other groups of healthcare consumers who remain able to access off-label medications that contain comparable levels of risk or quality of research or evidence to that of puberty blockers. It creates an inconsistency where some consumers have the ability to choose with informed consent and subject to professional obligations of the prescribing clinician to take off-label medication. Now, what they're saying is puberty blockers are currently off-label. That means they haven't been approved by MedSafe, so the onus is on medical professionals. But remember, we're talking about children that are being experimented on, confused children. And how can a child give consent when they don't fully understand the consequences? That's what Chloe said. What pubertal child is thinking about whether they can have a child as an adult, or bone density, or other implications? The Human Rights Commission goes on, adolescents who are subject to discrimination are more vulnerable to abuse, other types of violence and exploitation, and their health and development are put at greater risk. Light irony there. They are therefore entitled to special attention and protection from all segments of society. This means that the state needs to ensure that adolescent healthcare services are known and easily accessible, economically, physically and socially, to all adolescents without discrimination. Oh yeah, these children are subject to abuse and exploitation, all right, but it's by the radical gender activists. And think about that statement with a similar illness like anorexia nervosa. Does the Human Rights Commission want us to give those suffering children weight loss pills and book them in for a liposuction and tummy tucking operations so that we don't discriminate against them? No, we heal the mind, don't we? They then say children should be provided with adequate and appropriate information in order to understand the situation and all the relevant aspects in relation to their interests, and be allowed, when possible, to give their consent in an informed manner. This is consistent with the right to informed consent. Exactly. I mean, it should be informed consent, but we're talking about a child. But then we get to the absolutely worst bit. I hope you're seated for this. This proves just how radical and ideologically captured the Human Rights Commission is. Let me show you this bit. They say the risks identified of puberty blockers should form part of the discussion with adolescents and their whānau, so that an informed decision can be made consistent with the right to informed consent. But such risks should not lead to denial of access. The dignity of risk means having the right to make our own choices and self-determine, even if it could have negative consequences, in order to live an independent life. Risks should not lead to denial of access, even if it could have negative consequences. Independent life. We're talking about children here, you numbskulls at the Human Rights Commission. I mean, shocking. Does that also apply to drugs, cannabis, MDMAs, alcohol abuse, vapes, tobacco, pornography? Give them what they want, irrespective of the consequences or risks. I mean, it is unbelievable that they have written that. Finally, they say, the review did not identify any clear and significant risks justifying immediate withdrawal of the medication to all who are prescribed it. Rather, it found that the quality of evidence for the benefit or risks is low. And there is a need for high-quality longitudinal data and research to understand the specific needs of gender dysphoric adolescents. As above, any such research needs to involve active consultation with transgender people. Well, actually, that's what the research has already done. It's shown the effect on transgender people, including the fact that post-surgery as adults, the mental health problems don't disappear, even if your natural private parts do disappear. The Human Rights Commission is basically saying, you should use this medication until there is proof that it doesn't work. But at least you're doing something about the problem rather than nothing, and that makes us all feel better. It's what some people call pathological compassion. But actually healing the mind rather than chemicalizing, cutting and confusing the body is a far better option. It's the option that the adults in the room would choose. It's the option that parents would choose if they had all the facts. Now, just finally, the Human Rights Commission finishes their submission with research from both New Zealand and overseas shows concerning levels of mental distress for transgender and non-binary people, correct? Including high rates of suicidal thoughts and attempts, correct? This includes findings specifically relating to the impact of restricting access to gender-affirming care. That bit is completely made up. The research shows that even with the so-called gender-affirming, it doesn't resolve the significant mental health harms and may actually make them worse. What the HRC refuses to do is figure out that if you deal with the mental distress, suicide ideation and comorbid disorders, you remove the need for chemicalizing, castrating and confusing vulnerable young people. Oh, here's another really disturbing thing. I did a word search in the Human Rights Commission submission for the words family, whānau, father, mother, parent. Guess how many times these words are mentioned in the body of the submission? Not once. Zilch. It shows you just how dangerous the Human Rights Commission is to families and the contempt they treat parents and whānau with. The Human Rights Commission also seems more interested in the rights of the transgender industry and activists rather than the well-being of our children. Treat the Human Rights Commission with the absolute hostility it deserves.